for metastatic hormone-sensitive prostate cancer, the management of that disease has changed considerably in the last 5 years. In addition to androgen deprivation therapy, ADT, we now have a lot of evidence that, strong evidence that the use of docetaxel chemotherapy or one of the androgen receptor antagonists clearly improves outcomes. And so that's been very beneficial to men in improving their survival and their quality of life. At the same time, this disease for most men remains lethal. And so we need to find additional strategies for further improving outcomes for men with metastatic hormone-sensitive prostate cancer. That could include new combinations, addition of new drugs to existing drugs, better selection of existing drugs. Treatment of the primary disease itself may also further improve outcomes. Identifying biomarkers that will help us better use these drugs. And ultimately, I think the biggest unmet need, though, is actually using what we already have in our arsenal. There's data out of the UK and the US, and similarly in Australia, showing that utilization of these new therapeutic strategies, in addition to ADT, whether that's docetaxel, chemo, or an androgen receptor antagonist, the vast majority of men are not getting access to that. They're being treated with just ADT. And so we know that that's under treatment for the vast majority of men with metastatic hormone-sensitive prostate cancer. And if we want to improve their outcomes, all of the points that I've made before are valid. But the first thing we have to do is actually use what we've already got in our at our disposal. And so really, implementing clinical trial data into real-world practice is a key unmet need for these men.